Hi, this is Dr. Turovsky. Let's talk today about the early facial rejuvenation. What is for me early facial rejuvenation? These are mostly, of course, women, and they are in the late 30s or their 40s, maybe sometimes early 50s, where they actually have a very minimal signs of aging, but it's already there. They lost their shine of the 30-year-old woman, and they hate it. They hate these changes. And what it really means is gravity. Gravity brings everything down, so that means that everything is going down, not necessarily laterally, just down. And that's why typical facelifts don't help that much, because they are actually accessed from the ear side, and their only vector they can achieve is laterally. Doesn't matter if people call it the deep plane or the normal plane or super deep plane, it's still lateral pull. That's why it has to be done vertically, bringing tissues up where they belonged originally, not laterally. And it can be achieved with the internal approach through the little incisions inside the hairline, not at the hairline. A lot of surgeons do it at the hairline, and the patients are basically left with the ugly scars that cannot be covered. They no longer can expose these areas because the scars will always show. But if you do it from the inside the hairline and inside the mouth, there are really no scars to be visible. In this case, we combine the endoscopic brow lift with mid-facelift or middle facelift, which was done at the level of the bone, so super deep, in a vertical fashion. And on top of that, I also accessed her lower eyelids and repaired her lower eyelid bags, because that definitely adds to the final result. And on top of that, then we address the lower face. She has a minimal jowls, but to restore her beautiful jawline, you have to address that. And also the neck has to be addressed deeply, because that's the only way to really correct not only fat, which in her case is minimal, but also the deep muscles. Altogether, the goal is to restore the youth without adding tissues. I really am against adding fillers or fat transfers. It's very rarely necessary. It's only for people who lost a lot of weight and they really missing that part. However, for most women, it's absolutely not necessary. As a matter of fact, most of the time I remove some fat because they have too much of that. So altogether, restoring the shape and the youth means elevating. It's not pulling. So the old name facelift is actually very adequate, except that until now, most people didn't do the facelift. They did face pulling.